Hello, welcome to the Acharya Nidana Academy. In this particular video, we are going to discuss the importance of the subject Roga Nidana and Vikriti Vigyan. Whenever we are going to discuss about the Roga Nidana and Vikriti Vigyan, the discussion of Ayurveda diagnostics. In other words, what is the actual cause of the disease? What are the main clinical features? How to identify the disease? And what are the pathological events? And how to examine the patient? And how to make the differential diagnosis? How to know about the actual Vyadhyavastha or the stage of the disease? Etc. These are the different informations that are being learned in this particular subject. First of all, we need to know about why we need to learn this particular subject. Actually, it is a bridge or the connecting link between the Kriya Sharira and Kaya Chikitsa. As such, in the Western medicine, it is being said that physiology and internal medicine is being connected by pathology. In the same way, Ayurvedic Kriya Sharira and Ayurvedic Chikitsa Vidhana is being connected by the Roga Nidana, what we can say the Ayurveda diagnostics. As far as importance of the importance of this particular subject is concerned, it is being said that Dosha Dhatu Malamulam Sadadehasya. It is being mentioned by Ashtanga Hridaya. Sushruta says, Dosha Dhatu Malamulam Shariram. That means the human body is composed of dosha, dhatu, and mala. Dosha, in the sense, they are actually the bioenergies, which may be either sharirika, that is vata, pitta, and kapha, or it may be manasika, that is rajasika and tamasika. That means rajas and tamas, they are the manasika doshas. As far as dhatu are concerned, 7 types of the dhatu are being mentioned: rasa, rakta, mamsa, meda, asthi, majja, and shukra. As far as mala are concerned, mutra, purisha, and sweda. These are the main components of the human body. How we are going to say the presence of the disease in the body? So that is rogastu dosha vaishamyam. That means the imbalance in the dosha, either it may be sharirika or manasika, that is being termed as roga. Dosha samyam arogata. So that means the balanced state of the dosha, they are considered as arogata or health. The presence of the chest pain is indicative of the dosha abnormality, particularly vata dosha. So reddish discoloration in the skin is indicative of the dominance of pitta dosha. Swelling observed in any one or more parts of the body is indicative of kapha dosha dominance or abnormal vitiation of kapha dosha. The Charaka says, Vikaro dhatu vaishamyam, samyam prakriti ruchyate. So that means abnormal state of the constituents, dhatu, that's also being termed as vikara or roga. The balanced state of these, they are considered as prakriti or health. Sukhasamnikam arogyam vikaro dukkham evacha. So that means the Ayurveda says Anukula Vedaniyam Dukkham, that is considered to be Sukha, whereas Pratikula Vedaniyam, that is considered to be Vikara. So that means if the person is having the, what do you say, the comfortable situation that is indicative of arogya, or discomfort is being observed, that is considered to be roga. Further, Charaka says, Rogam adau pariksheta tato anantaram aushadham tatah karma bishak parshat dhyanapurvam samacharet. Whenever, if you are saying the ideally, if you are saying the disease first, then giving the treatment will be easier. In the sense, we have to interrogate with the patient and then give the treatment appropriately, then success will be certain. Which particular site of the body is being involved, whether is it amasha is being affected, or pakvasha is being affected, or rasadhatu is being involved, or mamsadhatu is being afflicted, or mutra is being afflicted, or sweda is being afflicted, or pranavasrotas is being afflicted, or rasavasrotas is being afflicted, or shukravasrotas is being afflicted, or otherwise which particular sroto dushti is being affected, whether atipravriti is there, or sangha is there, or whether the disease is considered to be samavastha or niramavastha, or whether the disease is considered to be sukhasadhya or krichasadhya, or yapya or pratyakshaya. By looking at all these different parameters, we will be coming into a conclusion that the person is suffering from this particular disease. Then, if you are giving the appropriate line of treatment, then the whatever the success you are going to achieve, that will be not accidental, that will be certain. Further, it is being said in Charaka Samhita, Hetulinga Ushadajnanam Swasthaturaparayanam Trisutram Shashvatam Punyam Bubudheyam Pitamaha. Trisutra Ayurveda is being said by Charaka Samhita. Hetu Sutra, Linga Sutra, and Aushadha Sutra. Wherein the Hetu Sutra and Linga Sutra is being coming under the purview of Roga Nidana and Vikriti Vigyan. So that means when you are saying Trisutra Ayurveda is 100%, 66% is considered to be coming under the purview of Roga Nidana and Vikriti Vigyan. This highlights the importance of Roga Nidana as such. Further, it is being said that Roga Nidana and Vikriti Vigyan is comprised of 4 different words: Roga, Nidana, Vikriti, and Vigyana. So regarding the dissecting the each words now one by one. Roga, it is considered to be Ruja Kartritvena Rogatva. Any of the discomfort produced in the body, that is considered as Roga. So here further subdivisions are being made. Different classifications of Roga are being made. Out of them, we are going to discuss few of them. The detailed description is available in the textbooks. So regarding the physical and psychological. Physical in the sense pain in the knee joint, or pain in the chest, headache, vomiting, all these are considered to be physical symptoms as such. In burning maturation, it's a kind of physical symptom. When you think about psychological symptom, person is having the lack of interest to do any of the activities, or he is having the disturbed mood as such, or otherwise he is having the emotional lability. These are considered to be psychological symptoms. So all these are coming under the purview of Roga. As far as classification of the diseases are concerned, Sharirika and Manasika Vikara are being mentioned. As such, if you are getting any kind of physical symptoms, They are categorized under Sharirika Vikara. So that means that require the Sharirika line of treatment, that is either Vamana, Virechana or Basti or Nasya, etc. Whereas if the person is have psychological symptoms, so that require Manasika line of treatment. So that means Rajo Dosha Chikitsa and Tamo Dosha Chikitsa. Further, it is being said that Sattva Vajaya Chikitsa can be performed in that particular situation. Further, depending upon the cause of the symptoms as such, the diseases are categorized into three: Adhyatmika, Adhibhautika, and Adhidaivika. Adhyatmika type of the diseases where the cause is considered to be self-induced. So, because of the person's own abnormal diet pattern or regimen, such as Adhyashana or Atyashana or Vishamashana or Viruddhashana, etc., the person is developing the disease manifestation. Wherein Adhibhautika refers to the person will be having the manifestation of the disease because of the others, such as the trauma induced by others, or the weapons used, or because of the wild animals, or such as or otherwise insect bite or animal bites, etc. Wherein Adhidevika Vikara, wherein the diseases are manifested not because of the self-induced or not because of the causes by the external other causes, they are considered to be beyond the human understanding. That means the divine cause may be the reason for the development of Adhidaivika Vikara. For example, natural calamities, or otherwise the presence of the hunger or thirst, they are considered to be Adhidaivika Vikara. Further, depending upon the nature of the treatment performed in the patient, two types of the Vikara are being mentioned: Shastra Sadhya and Snehadi Kriya Sadhya. Shastra Sadhya in the sense the diseases are wherein we are going to use the Shastra or surgical instruments to cure the disease processes. Wherein Snehadi Kriya Sadhya in the sense we are going to give the Snehana or Svedana or Panchakarma or Shamana therapy, etc. to pacify the disease processes. Depending upon the curability and incurability of the illness, diseases are considered to be four varieties: Sukha Sadhya, Krishna Sadhya, Yapya, and Pratyakshaya. So like this, so when you think about the Roga, these are the subheadings that we are going to discuss in this particular subject. The next term, that is Nidana. Nidana is being used in two different ways. That is Vyadhi Bodhaka Nidana and Vyadhi Janaka Nidana. Vyadhi Bodhaka Nidana in the sense they are the diagnostic tools as such. That is Nidana, Purvarupa, Rupa, Upashaya, and Samprapti. That is Nidana in the sense the constitutive factor, Purvarupa in the sense the prodromal symptoms, Rupa, that is the clinical features of the disease, Upashaya, that is the techniques which will be helpful in confirmation or rejection of a particular diagnosis, and Samprapti, the pathological events or pathological processes. They are coming under the diagnostic tools. The second the meaning of the Nidana, that is Vyadhi Janaka Nidana, that is nothing but the constitutive factor as such. So this is what is considered to be the term Nidana. Wherein the third term, that is Vikriti. Vikriti in the sense the individual diseases as such. So that means the Nidana, Purvarupa, Rupa, Upashaya, and Samprapti of each of the diseases, Upadrava of the diseases, Arishta Lakshana of the diseases, Sadhya Sadhya of each of these diseases, identifying the asadhya lakshana of these diseases, and how to do the rogi pariksha or examine the patient to identify the each of these different stages of the disease that is categorized or coming under the purview of Vikriti. And Vigyana means the Vishesha Jnana or specific knowledge related to Roga, Nidana, Vikriti, etc. They are categorized under this particular heading as such. It is being mentioned that Nasti Rogo Vina Doshe Yasma Tasmad Vichakshana Anuktamapi Doshana Linger Vyadhim Upacharet. It is being mentioned that so without the presence of the abnormal dosha, no disease can be manifested. So, and it is also not possible to diagnose the to name the any of the diseases as such by looking into the lakshana produced in the patient. We are going to make the diagnosis of the diseases as such. If you split this particular shloka, na asti rogo vina doshaihi yasmat tasmat vichakshanah anuktam api doshanam lingaihi vyadhim upacharet. Further, as far as the quantification of the abnormal proportions of dosha dhatu mala, it is difficult to predict. Why? Vailakshanya sharirana asthaitva tathaiva cha dosha dhatu malanam tu parimanam na vidyate. So that is the quantification of these dosha, dhatu and mala is difficult because of the peculiarity of the patient in terms of the physical strength, in terms of the mental strength, in terms of the degree of etiological factor exposure, in terms of the degree of the clinical features, in terms of the degree of the mental strength of these. So like this, the multitudes of the different factors, they are going to decide the degree of dosha dhatu and mala. They will be innumerable. Hence, we are going to make the diagnosis of the disease accurately. Regarding the different concepts, we need to be familiarized while making the learning this particular subject properly. These are the different concepts that we are going to familiarize. First of all, concept of dosha, dhatu and mala. So that means we have already discussed earlier, basically sharirika and manasika dosha. Sharirika dosha, vata, pitta and kapha. Its causative factors, its prakopa lakshanas, etc., vruddhikshaya lakshanas. And regarding the dhatu, saptadhatus, its vruddhikshaya lakshanas. And mala, mutra, purisha and sweda, its vruddhi and kshaya lakshanas. They are going to get observed in the patient. And regarding the concept of Rogamarga, three types of the Rogamarga being mentioned: Abhyantara, Bakhya and Madhyama. Nearly around more than 90% of the diseases are being manifested in the individuals because of abnormal diet pattern. It could be Adhyashara, it could be Vishamashana, it could be Samashana, it could be Viruddhashana, or it could be Atyashana, etc. Or it could be Ruksha Bhojana, etc. etc. So that is the reason Abhyantara Roga Marga is very, very important as far as initiation of the disease manifestation is concerned. From there, the pathogens are being present or abnormal vitiated dosha are going to the shakha, what we can say the intravascular compartment or interstitial compartment or intracellular compartment, outside the bones, joints, and the vital parts. There, where the what we can say the Bahya Rogamarga. If the disease process is continued, then these pathogens will enter into the bones or into the joints or into the vital parts. What we can say the Madhyama Rogamarga. So that means we need to know about the concept of Rogamarga well. If you want to, what do you say, the diagnose the disease appropriately. Concept of Kriya Kala. Whether the pathogens are being present in Sanchaya stage or Prakopa stage or Prasara stage or Sthana Samshaya stage or Vyakta stage or Bheda stage. In all these occasions, we need to know about these particular concept of Kriya Kala well. If you think about the concept of Srotas, nearly around Bhashya Srotas and Abhyantara Srotas are being mentioned as per Ayurveda. 9 Bhashya Srotas in males and 12 Bhashya Srotas in females. We need to know about the entry of the pathogens in any 1, 2 or more of these Bhashya Srotas has to be analyzed properly. Further, we need to know about the Abhyantara Srotas. 13 types of the Abhyantara Srotas are being mentioned as per Charaka Samhita. 11 pairs of the Abhyantara Srotas are being mentioned as per Sushruta Samhita. We need to know about the involvement of the Srota Mula, which particular Srota Mula is being afflicted. And we need to know about the actual Kavaigunya is taking place in the patient. What type of the Srota Dushti is being present in the patient? Is there any presence of Sroto Viddhata or injury to the Srotas is being present or not? That has to be analyzed. Concept of Agni. What type of Agni is being affected? Whether is it the Jatharagni or whether is it Dhatwagni or whether is it Bhutagni is being afflicted or not, that has to be analyzed. Regarding the concept of Ama, what type of Ama is being affected? Whether is it due to Jatharagni Madhyajanya Ama or whether is it due to Dhatwagni Janya Ama or whether is it Bhutagni Mandhyajanya Ama, that has to be analyzed. Or whether is it Sama or Nirama stage is being present in the patient, that has to be analyzed. Concept of Koshtha. When you think about Koshtha, it is considered to be the excretory function of alimentary canal can be considered. Whether is it Krura Koshtha or Mrudu Koshtha or Madhyama Koshtha has to be analyzed. Regarding the concept of Doshagati, what type of stage of the dosha Prakopa is being present? Whether is it in the Vruddhavastha or Sthanavastha or Kshayavastha, or whether this is in the Chaya stage or Prakopa stage or Prashama stage, or whether is it in the Bahya or Madhyama or Abhyantara Doshagati is being present or not, or whether is it in the Prakrita stage or Vikrita stage, has to be analyzed. Concept of Nidana Panchaka. We have discussed earlier, that is the regarding the what type of the Nidana, that means Purva Rupa, Rupa, Upashaya and Samprapti. We have to analyze each of these in detail. In terms of the Nidana, whether the type of the Nidana, what type of Nidana is being present, whether is it Sannikrishta Nidana or Viprakrishta Nidana or Vibhicharya Pradhanika Nidana, or whether is it Asatmindirata Sanyoga Prajnaparat or Parinama, or whether is it the Utpadaka Hetu or Venjaka Hetu, or there is it Dosha Hetu, Vyadhi Hetu or Ubhaya Hetu, or there is it Bahya Hetu or Abhyantara Hetu. In terms of the Abhyantara Hetu, further subclassification, whether is it Urdhva Adaha or Tiryak Gati, or Vriddhisthana or Kshaya Gati, or the Shakha, Kosha, Brahmasti Sandhi Gati, or Prakrita or Vaikrita Gati, or Ashaya Apakarsha Gati, that has to be analyzed in terms of the Nidana assessment. In terms of the Pururupa assessment, whether is it Samanya or Vishesha Pururupa, or whether is it Sharira or Manasika or Sharira Manasika Pururupa, that has to be analyzed. In terms of the Rupa, you have to analyze what type of the Pratyatma Lakshana is being present. Based on the Pratyatma Lakshana and associated features, you are going to analyze what type of the Srotas is being affected, what type of the Srotadushti is being affected, what is the actually the Vyadhyavastha, etc. that can be analyzed properly. Regarding the Upashaya, in terms of the Aushadha, in terms of the Ahara, in terms of the Vihara, in relation to Hetu and Vyadhi, we are going to analyze to confirm or reject the diagnosis. When you speak about Samprapti, we need to know about what type of the Samprapti will be taking place. Which type of guna increase is being present in the patient. Whether is it Ruksha guna or Lagu guna, etc. This can be done with the help of Vikalpa Samprapti. We are going to know about the dominance of the dosha involved in the patient and the subdominant dosha involved in the patient that can be analyzed with the help of Pradhanya Samprapti. When you think about the dominance of the bala of the patient or of the disease can be analyzed by the bala samprapti of the patient. When it say about the dominance of the dosha in terms of the diurnal variations or seasonal variations can be performed with the help of kala samprapti. One more specific variety of the samprapti is being mentioned by Charaka Samhita, that is Vidhi samprapti. So this will be helpful in planning the actual line of the treatment or the what do you say that the stage of the illness can be analyzed so that the appropriate treatment can be given. When you think about the concept of Vyadhi, that is the what type of the Vyadhi it is, whether is it Sharirika or Manasika, or whether is it the Saumya or Agneya, or whether is it the what do you say that the Vayavya, that is the three varieties, or whether is it Pura Karmaja or Pratyutpanna Karmaja, or whether is it Adhyatmika, Adhibhautika or Adhidaivika, or whether is it Mrudu Vyadhi or Madhyama Vyadhi or Atimatra Vyadhi, that is mild, moderate or severe form of the disease, or whether is it in terms of the Sadhya Sadhyata, whether it is Sukha Sadhya or Krishna Sadhya or Yapya or Pratyakheya, in terms of the main factor affected in the patient, 7 subtypes of the classification: Adi Bala Pravritta, Janma Bala Pravritta, Dosha Bala Pravritta, Sanghata Bala Pravritta, Kala Bala Pravritta, Daiva Bala Pravritta, or Swabhava Bala Pravritta. So, this is what we are going to say in terms of the Vyadhi classification. In total, we are going to say about what type of the Vyadhyavastha is being present in the patient. That is, we are going to analyze in this particular aspect. In terms of the concept of Pariksha, so that means here we are going to see or do the examination of the diseased individual by the either Pratyaksha Pariksha or Anumana Pariksha or Aptopadesha, or otherwise what we can say the Prashna Pariksha also. Further, Ashtasthana Pariksha and Dashavidha Atura Pariksha are also being mentioned. By that, we are going to analyze the Vyadhyavastha of the individual. Vyadhyavastha in the sense, whether is it in the Samavastha, Niramavastha, or whether the particular pathogen or the abnormal dosha is present in the alimentary canal or intravascular compartment or interstitial compartment or intracellular compartment, or whether this particular pathogen is being present in the rasa, rakta or mamsa or asthi or majja, etc. Or whether the particular vyadhi is present in sanchaya, prakopa or prasara, etc. So like that, multiple factors are coming under the analysis of Vyadhyavastha. Regarding the concept of arishta, in the sense the signs of imminent death, whether they are present in the patient or not, that has to be analyzed there. Concept of sadhya sadhyata, when you say about concept of sadhya sadhyata, whether the disease is curable or incurable, this can be analyzed by the dominance of the dosha in the patient, whether is it one, two, or all the three, or the involvement of the dhatu, whether one dhatu is affected, or two dhatu is affected, or three dhatu is affected, or four dhatu, or all the seven dhatus are affected, or whether the one Rogamarga is affected, or multiple Rogamarga are affected, or the like that. So sadhya sadhyata is analyzed based on these different parameters. We say about the concept of ashraya and ashrayi. If you are having the doubt in determining the dosha affected and dhatu involved, we are going to use this particular ashraya and ashrayi bhava. Concept of dosha paka and dhatu paka, in the sense the dhatu paka is helpful in determining the vyadhyavastha or in determining the progression of the disease, whereas the concept of dosha paka is helpful in determining the reversal of the disease process. So concept of udarka, in the sense, so that means it's pathological events, that is sequel of pathological events, that is we are going to analyze there, whether it may be harmful or harmless. So in this particular concept of udarka, one main point that can be highlighted, all upadravas can be considered as udarka, but all udarka need not be upadrava. Whereas the one major aspect while discussing about the concept of Rogamarga here, for this you need to refer the concept of Rogamarga mentioned in the Acharya Nidana Academy channel. We have to look into that particular part as such video. So here it is a schematic representation of the Rogamarga here. When you say about the schematic representation, in the sense, absolute left side, what we can say, it is the concept of alimentary canal. So which is having the five main organs. They are mouth, esophagus, stomach, small intestine, and large intestine. They are unique because of the specific gut transit time. So immediately next to that, what we can say, that is intravascular compartment. And immediately next to that intravascular compartment is interstitial compartment. And next to that, it is intracellular compartment. So as we have discussed, gut transit time will be different in different parts of the alimentary canal or gastrointestinal tract. In the mouth, it may be few minutes, which may be for the the swallowing of the food, etc. Whereas in the esophagus, gut transit time will be in seconds. Whereas gut transit time in stomach will be 2 hours. Whereas the gut transit time in small intestine, it will be around 6 hours. Whereas the same gut transit time in large intestine will be 24 to 48 hours. So that means, these are the movement of the food substances that will be taking place from the mouth to esophagus. So that means they will be helpful in transforming the macromolecules into micromolecules. That means in the stomach, that will be macromolecules will be transformed partially into the intermediate molecules. From the stomach, both these macromolecules and intermediate molecules, they will be entering into the small intestine. In the small intestine, they will be converted into micromolecules. And from the stomach, that is partially the micromolecule they are being present, such as the glucose, etc. They will be directly enter into the capillaries of the stomach. Whereas micromolecules found in the small intestine, they will be entering into the capillaries of the small intestine. Then the further the minerals, etc., they will be going to get absorbed in the large intestine. Then these micromolecules, they are being absorbed from the stomach, small intestine, large intestine. They will be entering into the portal system. From there, it will be entering into the heart. From the heart, they will be entering via aorta to the capillaries of the cardiovascular system. From there, it will be entering into the interstitial compartment. From the interstitial compartment, they will be moving into the cells. What we can say, that is about the intracellular compartment. In the same way, the pathogens also move from the alimentary canal into the intracellular compartment. That is, the pathogens, they will be entering from the mouth, maybe in the form of either adhyasana, that is overeating, before the emptying of the food into the duodenum. Then vishamashana, abnormal diet pattern in terms of the timing and quantity. Whereas samashana, the consumption of the food, both wholesome and unwholesome diet together. Then viruddhasana, the consumption of incompatible food substances. Then the atyashana, the consumption of the food at a time, large amounts of the food. What we can say, the akantha bhojana, etc. All these are considered to be the main the causes. They are considered to be due to abnormal diet pattern. From these, the pathogens will be entering into the stomach or small intestine, large intestine, which are responsible for the inflammatory reaction to happen in the stomach, small intestine, large intestine, which are responsible for the inflammatory markers to be produced in the gastrointestinal lumen. This will be damaging the mucosa of stomach, small intestine, large intestine. That means the macromolecules, they start enter from the lumen into the capillaries of the stomach, small intestine, large intestine. As they are macromolecules, they will be bypassing the portal system. They will be entering into the lymphatic system. From there, they will be entering into the superior vena cava at the junction of a left internal jugular vein and subclavian vein. From there, they will be entering into the right atrium, right ventricle, pulmonary trunk, pulmonary capillaries, pulmonary veins, and the left atrium, left ventricle, and aorta, arteries, and capillaries. That means these are considered to be the intravascular compartment. From the capillaries of the cardiovascular system, these pathogens will enter into the interstitial compartment. From there, it will be entering into the cells. What we can say, that is the intracellular compartment. This is what we can say, the concept of Dhatupaka there. So here we have to be very well understood. We have to understand the concept of Rogamarga well if you want to give the line of treatment properly. So that means why we need to know about all these different aspects. So that means we have to identify the actual site of the lesion. That means we have to know about the actual Vyadhyavastha. Then we have to do what we can say the prognosis of the disease appropriately. So that means whether the disease is curable or incurable, that is Sukhasadhya or Krishnasadhya or Yapya or Pratyakya, that has to be analyzed. And thereby we are going to plan the line of treatment properly. Whether is it possible to give the actual simple Langana therapy, or whether is it the Shamana therapy is needed, or whether Shodhana therapy or Panchakarma is necessary or not, that can be analyzed by knowing this Roga Nidana and Vikriti Vigyana well. So the take home messages from today's discussion are Roga Nidana and Vikriti Vigyana is a connecting bridge between the Kriya Sharira and Kaya Chikitsa. Kriya Sharira, it's the Ayurveda physiology, whereas Kaya Chikitsa, it's Ayurveda therapeutics. Whenever we are learning the Roga Nidana, we are going to learn the what is the actual site of the lesion involved in the patient. What is the actual cause of the disease? What are the different clinical features of the disease? What are the pathological events happening in the patient? And how to interact with the patient suffering from the illness? And how to actually do the assessment of the Vyadhi? And what is the prognosis of the disease, etc. etc. We are going to learn by studying Roga Nidana. Among that, today we have learned one of the major, very fundamental concept of Rogamarga as such, which is helpful in knowing about the site of the disease and to plan the to make the actual prognosis of the disease, or what we can see the sadhya sadhyata of disease, and to plan the actual line of treatment. The right line of treatment can be planned. So, dear ANM members, that's all for today. What are the major key takeaways from today's discussion? Mentioned in the comment box below. And what is the one particular topic that you would like to have the discussion in the coming sessions? Mentioned in the comment box. And if you are liking this particular video, then put a thumbs up and spread this particular video to the maximum number of true Ayurveda learners, so that we can make a huge movement out of this particular small message. That's all for today. Thank you.